Hey everybody, Suzanne here with caregiverhaven.com. So today I've got a really special guest for you all. You know that we've been talking about medications, and who better to interview but Ashley? Ashley is a pharmacist, right? You've got your doctorate degree in pharmacy and you've been practicing. Well, why don't you just tell us a little bit about yourself?
So I have been a pharmacist for about 10 years at this point. I graduated from Marshall University in 2017, so just shy of 10 years. And I work in a retail setting for most of those. I have actually been in a clinical pharmacy setting for about 3 years now. And I deal with a lot of medication therapy management and prior authorizations, as well as endocrinology. So, definitely a big step up from retail, allowing me to use my degree to its fullest.
Well, it sounds like a much better opportunity than working retail. And that's what brings us to the conversation today, because a lot of caregivers and their seniors do not understand how, medication reconciliation works, what it even means. They don't understand how much the pharmacist can do for them because they don't know to ask the right questions. Many times they just go in to pick up their prescription and it's not ready and they get mad and don't understand why. And since you have been on the retail side of pharmacy, the questions that I want to ask are, you're going to remember many patients that have come through your doors and
Definitely.
have probably yelled at you, and I'm sorry for that. So let's go ahead and get started. We'll try to keep this at 30 minutes, but we always run over, so whatever. Okay. My doctor, here's the first question. Tell me if you've ever heard this before. My doctor says that I need this medication. Why can't I get it?
That is a big one that we in a retail setting would hear constantly. Even not in a real retail setting, I hear that one a lot. It's it's not that because your doctor says you need the medication, that doesn't automatically mean that the insurance thinks you do. So there are a lot of things that go on between your doctor's office and you picking that medication up at the pharmacy that really it's kind of the behind the scenes part that a lot of people have never seen. If you've never worked in pharmacy, you don't see these things either. It could be that your insurance doesn't want to pay for that medication because they have something else that's similar to that medication that they prefer to pay for. It could be that that specific medication is very, very expensive and the insurances want you to try something that's more cost effective or cheap. That doesn't necessarily mean it's not a bad medication. It just means that this specific medication that they're trying to give you just costs a little bit more than what they would prefer to pay if they can get by with paying for something that doesn't cost as much.
Even though the doctor has ordered it, I mean, insurance is not a doctor. They don't have a medical license.
Right. And that's the thing. It's very frustrating for us because obviously we as pharmacists and your doctors and everyone involved in your care, no one wants to see you not do well or not get the medication that you need. The fact is though, your insurances do have physicians and pharmacists and people in the healthcare field that work for them that sort of make up these formularies, which are the list of preferred drugs that the insurances have. So
Uh-huh.
because of that, there are people who have a clinical background, who have practiced medicine, have went to medical school, kind of making these decisions for what the insurances will cover and what they will pay for. Granted, it's not always ideal and it's not always up to date with the most current new drugs that are out that are better than the last round of drugs that were out.
Oh, is this called prior authorization?
So prior authorizations are what happens when your doctor sends in a medication that is either not on that formulary list that I mentioned before, or not exactly an inexpensive drug. So if the drug is very, very expensive, most of the time it will require a prior authorization. And what that means is that your insurance needs a little bit more information about why you need this medication versus the ones that they do prefer to pay for. So basically, how that looks on our end, if you're at your local CVS or Walgreens or any retail pharmacy that you may use to pick up your medications from, they don't have any control over that. They run your prescription through the insurance. They see that it needs a prior authorization, and then they send that directly to your doctor. Now, a lot of doctors' offices, those requests typically go as faxes from your pharmacy. So my suggestion would be if you're ever told at the pharmacy that your medication needs a prior authorization, my suggestion would be to call your doctor's office, let them know so they can go ahead and get started on that. Because even though your pharmacist or the tech at the pharmacy says they're going to send a request to the doctor's offices don't always get those. So once the doctor is notified that your prescription needs a prior authorization, then either their nurse, or if they are lucky enough to have a clinical pharmacist that specializes in these things in their office that helps them with prior authorizations, they will submit this to the insurance with chart notes, your labs that you have drawn, everything basically that they have access to that shows that this medication is necessary for you and that you need this medication. Sometimes the insurance will still fight back a little bit, saying, like, if there's one little thing missing. So it may take some time. I've had prior authorizations that I've worked on personally that have taken over a month to get approved because,
Really?
yes, we have one insurance plan in particular that I deal with on a daily basis. They are very, very picky. They are very, very hesitant to pay for anything that's not on their formulary. So we will have to submit the initial information. Typically, we have a yes or no from them within about 7 days. If it's a no, then we go into the appeals process where we have to basically create a case for you. We're basically going to battle with this insurance company, for lack of a better word. Um, I personally will start with a written appeal form. Now, with that being said, some insurances, even if you submit these as urgent, some insurances can determine on their end that this is not urgent. So I may have a prescription for a patient trying to get Eliquis, let's say, or I see a lot of GLP-1 medications, so a lot of like Mounjaro, Ozempic, things like that. We may have patients that have been on these medications for years, but they switched their insurance company. So at that point, we go to do the prior authorization. It initially gets denied. Then my next step will be, let's do a written appeal, send all of the chart notes, all of the labs, all of the information that we have basically with a letter of medical necessity that basically just says, hey, this is why this person needs this. These are the reasons why. This is why their doctor wants them on this medication. And then we send that over. I've had insurances say that because of the type of medication, it's not urgent. I've had insurances say that they don't do urgent appeals. So some insurances can take up to 30 days to approve these appeals, or if they further so deny it, then we have to go basically do a phone call with them to try to argue our case before, as kind of like our last ditch effort, which typically from those we have an answer same day, but it's, you kind of have to do that written process first. So it can take up to 30 days, which is absolutely terrible for patient care.
I can't imagine if somebody's on a medication like, Zepbound or Monjero or, Ozempic and then they've switched companies. And now all of a sudden they can't get it for 30 days and they've been on it. Or any of these heart medications that now they can't get them. And you're the one trying to make the appeal, and they're saying, well, it's going to take 7 days before we even look at the appeal. And then another 7, and well, we got to take longer to look at it. And they're dragging it out as long as they can. And this is, like you said, it's patient care. Patients are, end up in the emergency room. I would think that they want their what do they call them? Their clients, their guests, their customers, who knows, right? I would think they'd want to keep them alive and out of the emergency room.
You would think, I mean, you would think that, but this, because the current job that I have and all the things that I do with prior authorizations, it absolutely blows my mind. Some of the things that I do see, just, I never imagined that it was so difficult to get things approved through insurances from time to time. And we have a lot of patients that if we do luckily like get them approved for a continuation of therapy, they have to significantly reduce their dose, especially if it's one of those medications such as Mounjaro, Ozempic, something like that, where you have to slowly increase your dose as you go. We have a lot of patients that have to just take something else in the meantime to keep their blood sugar down, or if it's a heart medication, they basically have to take something else that doesn't work as well because in the meantime, they can't just go without their medication.
Right. So when going back to where the doctor has written a script and the patient says, the doctor wrote the script and I can't get this medication. And the insurance company says, okay, we don't want them to get this medication. We want them to try this medication first. Then what do you have to do? If you don't appeal and you just give them whatever medication the insurance has, the patient shows up at the counter for their medication. Have you called the doctor's office and said, we have to switch it? Have you called the patient and said, we're going to switch it because the insurance comes? So you have to get permission from the doctor. You have to let the patient know, and then you have to let the patient know that it's going to take longer to fill it because you've got to get a new medication. Do you have to get a new script too?
Yeah. So most of the time, even though it's a similar medication, it is a completely different medication. So we do have to call the doctor's office first and foremost, get permission to make sure that it's okay with them for the patient to have that medication. Then they have to send a new prescription to us. Typically, we try to call our patients and let them know, hey, your doctor prescribed you this, but it's not covered. We can get you this instead. Now, a lot of times the doctor's office will reach out to the patient to explain the change to them in the instances I've seen anyway. So a lot of times your pharmacy may not contact you directly to tell you this. It may be your doctor's office that calls you to tell you that the medication is going to be different. Either way, at the pharmacy level, we're waiting for a new prescription. And then once we receive that prescription, then we can fill that for you. And, a lot of these insurances require that you try these medications. That doesn't necessarily mean that if it doesn't work for you, that you're stuck with that medication. If the medication that they send in to replace the one that the doctor originally wanted, if that doesn't work for you, then we can go back to square one and either your doctor's office or whoever does the prior authorizations for your doctor's office can go another round with the insurance and try to get it approved after you've tried something that they prefer.
Unbelievable. Unbelievable. No wonder the seniors are sitting there waiting and waiting and waiting and not getting their medications.
There's a lot more behind the scenes stuff than most people realize. And unless you do it every day, I never realized that much went into it until I worked for a place where I took care of those.
And it seems like it's getting worse and worse. I had a patient come in once to my office and she brought all this paperwork with her. And she said, okay, if you're going to prescribe something, here's my formulary. Here is what the insurance company has listed that they will pay for, tier one, two, and three, right? Because
Mhm.
what tier one's the cheapest, I think, right?
Yep. Yep.
And she laid it out there for me, and it was so easy for me to pick things from her tier one. And it saved probably all that aggravation. Um, is that something you recommend that seniors do and caregivers do is take the formulary in because the doctor doesn't know?
So if you can find that very easily, most insurances do have websites that have these on them. The only problem you run into is there are certain insurances, and I see this with Medicare plans a lot. So with seniors especially, for instance, one that I see that's pretty common, we see a lot of in this area, Humana, and we see a lot of Anthem Medicare plans. And both of those, they have like 10 different plans that you can choose from. So all 10 of those formularies may be listed on their website. So if you do go that route, it's important to know what plan you have in order to get the right formulary when you go onto their website to get that. But pretty much all insurance websites do have those formularies listed for patients. And a lot of times the paperwork that you get when you're with your insurance card and everything, they'll send you like that big packet that has like a booklet in it. A lot of times that formulary is in that booklet that they send.
It is, and it's pretty easy. I mean, you could just take that in with you. It would save time. You say that you have to call the doctor's office, but you never speak to the doctor, do you? I never
No,
answer.
it's usually a nurse, or in our case, I talk to a lot of the dispensing pharmacies and stuff. The health system I work for is fortunate enough to kind of have the specialty pharmacy, which is what I currently work in, where we are kind of the go-between with the pharmacy and the doctor's office. So we don't work in actually dispensing the drugs. We're not the ones you see when you go to the pharmacy to pick everything up, but like my office is in an endocrinology office. I'm tucked in there with them. I'm embedded in their clinic. I do their prior authorizations. I will talk to the dispensing pharmacies when they call, to do all of these things. I will take care of it. And so they're still talking to someone who knows what's going on, but it's not necessarily that they're talking to a doctor. Personally, from a retail standpoint, when I worked at CVS, I never ever talked to a doctor directly unless I got lucky and the nurses weren't available, but the doctor was for some reason. Nine times out of 10, though, you are talking to one of the nurses, which,
And then
you
they
know,
got to check with the doctor.
exactly. And they're usually very helpful in my experience. I've had some very helpful nurses over the years that have been great, and they're very quick to respond. They are very quick to get back to us if the doctor's in a room with a patient and they have to call us back. But just be aware that there is some back and forth with everything, and nothing is instant. 90% of the time, you are not going to have a response. Sometimes not even in the same day, just depending on how busy your doctor's office is. And you know, it's we don't want to say you're not our only patient because at the end of the day, we want to take care of every single patient with the best of our abilities. But the fact is, you're not the only person that provider is seeing. You're not the only person that pharmacy is seeing that day. So there are a lot of factors that have to be taken into consideration. And I know it's frustrating from a patient standpoint because I have been in that situation before. So it is very frustrating. It is very disheartening almost for patients when these things do occur. But just know that at the end of the day, your pharmacist and your doctor's office, they want to do what is best for you. Nobody wants to see you go without your medication.
Except insurance.
Yes.
No,
Sometimes it feels that way for sure.
yeah, I'm sorry, but when you don't pay your premium, they're right on you, right?
Yeah,
But
yeah,
you
no,
ask for
exactly.
your medication. Well, wait a minute. Have you ever had patients come up to your counter when you were working at CVS and say their guess they'll just have to die because they can't get their medication?
I have heard that a lot. Um, and that's, as a pharmacist and as someone who is very passionate about patient care and is very passionate about their job, it's disheartening for us to hear that as well, because we never want a patient to give up on taking care of themselves. We don't want to see you go without your medication. We don't want to see you suffer. We don't want to see you, you know, pass away, God forbid, if something does happen. And it's very easy to get frustrated and to lash out at the person standing in front. That is understandable. It's just know that we are doing everything that we can to keep that from happening. And if you are out of medication,
Uh-huh.
sorry,
No, go ahead. If they're out of medication.
was going to say, if you are out of medication, we will do everything we can to get you a prescription sent in for something that will be covered. But at the end of the day, we can, if it's something you're already prescribed, give you a holdover supply, depending on the type of medication. But we're only allowed to do 3 days of that. And we can't do it for anything that's a controlled substance. So anything that's considered a narcotic or a lot of pain meds, it has to be something that is medically necessary. And now a lot of people may say, well, my pain medication is medically necessary. My pain medication is there. And yes, you're not wrong. Like, as someone who has dealt with a lot of patients that deal with pain on a daily basis, these are things that ideally you can't go without, because you are miserable when you go without these. But at the end of the day, those are not what they consider life sustaining medications. So those are not things that basically are keeping you alive. But like your blood pressure medications, your cholesterol medications, certain antidepressants, and any sort of like psych meds, especially for treatment of bipolar disorder, things like that, we are allowed to give a 3 day holdover supply, especially if it's a Friday afternoon and your doctor's not in their office and you're not going to be able to get a hold of anybody until Monday.
That's a good point. So really what caregivers and seniors need to know is get the medication ahead of time. Make
If
sure
at all possible. Now, some insurances won't pay for things super early. Most insurances that I encounter will pay for things about 5 to 7 days early.
okay.
So some insurances won't. But if you notice, like if you fill up a pill box, or you know, if you are the one that is getting the medication out of the bottle every day and you notice that it's running very low, or if you are a caregiver and you are, you know, fixing up some sort of anything to help kind of organize that person's medication, it's very important to know, like, if you fill a pill box up and you notice that there's only a week's worth of medication left, that is the time to have that conversation with your pharmacy. Have that conversation about the refill to see if it is something you can get. If you call the pharmacy and we process the prescription and it's too soon to fill, then most of the time that rejection that we get on our end will tell us the date that it's allowed to be filled. So at least we have some sort of idea of when we can fill it. And a lot of times at that point, if it needs a prior authorization, then we know ahead of time, so we can try our best to have your doctor's office submit that prior authorization, have it approved, hopefully before you have to go without medication.
Well, if you do that and you see that it can't be filled until a certain date, does the pharmacy automatically fill it on that date, or does the person need to call and say, do I need to remind you to fill it on this, today's the day you can fill it. Let's fill it.
So it depends on the type of medication. It also depends on how the pharmacy's dispensing software is set up. So it's a lot of them will let you schedule it for the date that it's due. A lot from my experiences that I've had over the years, a lot of the dispensing software that the pharmacy uses to fill those prescriptions, a lot of it, they will not let you schedule controlled substances. So any narcotics you have, even things like Adderall, like people that take medications for ADHD, anything that's considered a controlled substance or what you may hear the term scheduled substance, those are things that we are not allowed to schedule, even though they call them scheduled substances. Um, those things you will have to call the pharmacy on the day that they tell you it is due to fill. Now, things like your blood pressure medicines, like your lisinopril and your atorvastatins, and even like Repatha and things like that are more expensive, because those are what we call maintenance medications and things that you are taking to maintain your health. Those things can be scheduled in most systems. Now, some of our smaller pharmacies, also known as independent pharmacies, I don't have a whole lot of experience with that side of things, so I'm not sure how the different dispensing softwares that they use work. But I know from your standard, like just chain pharmacies, I know they have the ability to schedule those medications for you.
Okay. And you all on a chain pharmacy, they'll dispense what, 1,200, 1,500, 2,000 prescriptions a day?
The dispensing pharmacy or the retail pharmacy I worked at before I left to come to the job that I have now, we were doing about 1,400 prescriptions a day. We were in a very rural area, and one of the other chain pharmacies nearby had closed. So we acquired all of their prescriptions as well. Um, and sometimes even though you're doing 12, 13, 1,400 prescriptions a day, the store I worked at, I was lucky enough that we had pharmacist overlap. So there were two of us there certain hours of the day that were considered our busiest hours. But I've also worked in pharmacies where we're doing over 1,000 prescriptions and I'm the only pharmacist there, and I may have two or three technicians with me. I'm the only one that can do the final check on the medication. I'm the only one that can do certain types of phone calls to the doctor's offices. I'm the only one that can take a prescription over the phone unless I have an intern or unless you're lucky enough to work in a state that allows the technicians that are nationally certified to take those prescriptions over the phone. So your pharmacist is doing a lot. It may look like we're just standing there looking at a computer screen or looking at a bottle of pills. We are doing a lot more than it seems like we are doing.
Really, you are. Everybody should spend a day behind the counter.
In an ideal world, it would be so nice for everyone to have that perspective, just because, I mean, people, you think of your local pharmacy, it's like, oh, you just slap a label on it. That's a term that I heard a lot when I worked in the retail world. I don't understand why it's taking so long. All you have to do is slap a label on it. All you have to do is count out 30 pills. And yes, we do that, but there's so much more that goes with that. We receive the prescription from your doctor's office, then we have to type that in. God forbid the person who initially typed it in may have typed something in wrong or left a refill off of it or whatever. So then it gets sent back to them to fix. Then it comes back to the pharmacist again. The pharmacist checks the actual prescription part to make sure that it was entered in correctly, to make sure there's no interactions with your other medications, to make sure that you're not allergic to any part of this drug that your doctor has written for you. Because, doctors are very, very smart, and I'm not discounting anything that they do because they are very smart and they know a lot. But In school, they don't specialize in drugs. They specialize in treatment. So at the end of the day, there may be a one-off side effect that your doctor doesn't know exists. There may be a one-off drug interaction that your doctor has no idea is a thing. And it could be that you have something else going on that makes this so much more serious than it would in a normal person. So that's something we look for. Then, once we do all of this, determine that everything is good and that this medication is not going to hurt you, then we send it over to the technicians to count out the pills or slap a label on it if it's something like an inhaler or whatever. And then it comes to the pharmacist. In most cases, different places are set up a little bit differently, but most places have that two-step verification where a pharmacist initially checks it, it's counted, and then it comes back to the pharmacist to make sure that the right pills are in the bottle, that we've given you the right amount, that we've given you the right, like some people have specific brands that they can take because they're allergic to some of the fillers that are in some of these medications. So basically we do that one final check just to make sure that what you're getting is what you're supposed to get. And then it goes into the bins and you can come and pick it up.
Wow. What a process. What a process. Plus, the phones are ringing, the customers want to talk to you, and you're trying to figure out if this drug is going to have harmful effects to the patient. And then you have to stop, and then you have to start back again. Where was I? Which patient was it? What medication was it? Well, let me ask you this. If I'm the patient and you tell me it needs prior authorization, can I just speed it up by calling my insurance company, getting them to take note that I've call the doctor's office? Can I do my own appeal? Can I do any of that?
So the initial prior authorization, the doctor's office does have to do that.
Okay.
Your best bet, if your pharmacy tells you that you need a prior authorization, your first call should be to the doctor's office. Now you can call the insurance, and they will give you an explanation of why it needs a prior authorization. At the pharmacy level, it doesn't tell us why, it just tells us that it needs one. So if you do want to know why before you call your doctor's office, then you can call the insurance and they will tell you. If you call your doctor's office, though, when they go to submit the prior authorization, there's a list of questions that they have to answer and they have to submit some other stuff with it. So the quickest answer there would be to call your doctor's office.
So when I call the doctor's office, what should I say to the doctor or leave the message? What should it be?
I would say something like, "Hi, my name is," and leave your name, date of birth. And then I would say something like, "I went to the pharmacy to pick up my," let's say it's Eliquis. "I went to the pharmacy to pick up my Eliquis. The pharmacist told me it needs prior authorization. Can you get started on that? Or is there something that you can do to help?" Or something along the lines of that. They know what the words prior authorization means. So if you just tell them it needs a prior authorization, then they'll get started on that as fast as they can. Most doctor's offices will have a nurse that deals mostly with the prior authorizations for each provider. So they typically have some hours throughout the day where they do paperwork and stuff. That's the paperwork that they're doing most of the time. So that's that's typically how that will work.
So
So
that message will be seen and that person will deal with it.
yeah, if you leave, most doctors' offices that I've called for things anyway, they have like if they have like several different providers in the office, they will have an option to leave a message for this provider's nurse, press one, and then so on and so forth. So just if you leave it on the line, the nurse's voicemail for that specific provider, most of the time they check those throughout the day. And they do check them daily. Sometimes they'll have the disclaimer that it may take up to 72 hours to get back to you or something. That's not always the case. If it's something that's truly an emergency situation, you can always hit the option to speak to someone. and leave a message with the person at the front desk. And usually they will get it to the nurse pretty quickly as well. So it you have options.
And what's the best message to leave when you're calling the pharmacy?
So a lot of times with the pharmacies, you you won't really get a voicemail. At CVS, I know you do because of the way their phone system is set up. You have to leave a message to call back. Um, and then they're supposed to return your call within so many minutes or so. I think it's like an hour that they will return your call in. In that case, like always leave your name and date of birth. That is a big thing. If they don't have your name and date of birth, they can't do anything to help you because they have to verify who they are talking to and who they're taking care of. So always leave your name and date of birth and just a quick description of what you need. We don't need the whole backstory. We don't need the whole, like, my sister's cousin's brother did this and said this, and now I need that. Like, just a quick explanation of what you need. And then when we call you back, if you want to tell us the whole story, that's fine. Like, you can tell us the whole story. But on the voicemail, just leave the information that's necessary for us because at the end of the day, we're getting probably 100 voicemails a day. So the shorter you can make it, the better for us, and the quicker we'll get back to you.
Okay, what medication, date of birth, name, what the medication is, and what do I need done? Do I need the appeal? Do I need to pick it up? What's the holdup?
Yeah.
What's going on with it? So we
Yeah. And if you're just calling to check in and you have to leave that message, just say, hey, this is my name, this is my date of birth. I'm just calling to check and see if my prescription can be filled yet. Please give me a call back. And we'll run it through, try to fill it, and then move on. And then I know you had asked a little bit earlier about appeals and if the patients could do their own appeals. Patients actually can. Um, they have to wait for that initial prior authorization to be denied. And in that, once it's denied, your doctor's office receives a letter, but the patient will also receive a letter either via email or in their patient portal or in the actual physical mail, depending on how your insurance does things. So you can actually do your own appeal. If you feel like you are capable to do that, you have the knowledge to do that, and you want to make a case for yourself, you can. We have patients a lot of times. I had a patient the other day. She wrote out a formal letter to go with the appeal that I was doing. So I did my appeal, but she also kind of put her 2 cents into it. If you want to do something like that, that is completely fine. You can even call your insurance and do the appeal over the phone. It is an option. The area I live in is a very rural, very underserved area, and um, a lot of people here, unfortunately, some of them never made it through high school. So they may not feel as comfortable doing that. They may not be as capable of doing that. But it is something that you can take your health into your own hands and you can, if you feel confident doing that, then 100%. Like if you've got a caregiver who is very good at those things and I mean, at the end of the day, you know your body better than anyone else's, you know your health history better than anyone else, especially if you've been to several different doctors over the years. So you know these things about your medication history and things like that. So it is an option.
okay, because they record the conversations, so now they know that the caregiver is saying, and that's the leadership that I talk about with caregiving. Is I want the caregiver to step up and be that leader to say, okay, I've tried everything. But I think the best way to get around the whole system is to just bring the formulary into, like you said, the right plan, get the right plan, bring in the formulary and say to the doctor, if you're going to prescribe something today, whatever it is, here is the formulary and we need to pick off that. And
Yeah,
that way
and
it gets
yeah,
filled.
well, and that's the thing too. Like even if they're looking at the formulary and they determine that you need like a tier 2 or a tier 3 drug, which is one of your more expensive drugs, it will say on that formulary if it has quantity limits or if it needs prior authorization. So at the end of the day, they're going to know ahead of time that it needs prior authorization and they can get started on that right away. They don't have to wait for someone from the pharmacy to call them or for you to call them or the insurance to contact them or however they get the message. They can just go ahead and get started on that prior authorization.
Would that help the doctor if the doctor knows when he or she writes the prescription and it says prior authorization on that formulary, then the doctor, before even leaving the exam room, doc, this is prior authorization. So put anything and everything in the medical chart that the insurance is going to see that's going to make this the necessary drug.
That is one of the things, that is the biggest thing, honestly. Um, Details in the chart notes. And that is something that if they know it needs a prior authorization, they can add those things while they're typing everything up and while they're putting things in their chart note. The situation with the office that I work in, I will a lot of times do a test claim when the provider wants to prescribe something. Our endocrinologist, she sends me like 20 different messages probably every hour asking if something's covered for a patient. I have the ability to do a test claim to see if it needs prior authorization or whatever. So a lot of times that situation puts us ahead of the game a little bit. I'm a very strong advocate for having pharmacists inside of clinics because of things like this. It delays, or not delays, but it speeds up the whole process. If something does need a prior authorization, I can go back to my office and submit it right then and get it out of the way. A lot of times, these different insurances, because of the area I work in, I know most of the insurances that I'm going to be dealing with, and I've done it long enough that I have most of their formula. I know what they're going to require. So I can tell the provider, like one instance is the Medicaid for the state that I work in. They have a specific list of drugs that they prefer you try before they will approve other medications. So the medications that I see a lot, especially the diabetes medications, I can say, okay, the patient hasn't tried this. The insurance is going to make them try this before we do this. So just cut out the middleman. Let's prescribe this, get them in there, get them started on this. If it doesn't work out, then we can get the other one approved. So in that instance, having that formulary will help because a lot of times the formulary will have over to the side, it'll have like maybe if there's some other drugs that are preferred, or it'll have it kind of split up into little sections. So it'll have it split up by disease state, and it may have every drug that they could potentially cover for that disease state, but it'll say no PA required, or it'll say quantity limits, PA required. So that kind of gives them a broad overview to say, okay, you haven't tried this medication. This is covered without a prior authorization. Let's go ahead and start you on this, see if you do well on this, and then we can move forward if it does not work.
Oh, it would just be so nice if the patients walked into the doctor's office knowing these formularies and said, this is what I can do. Oh, man, I never realized that this was how difficult this was. Yes, you're right. There should be a pharmacist in every single clinic that can, because I do a lot of, what do I do? I'm proactive for my clients and for my caregivers in terms of getting them pre-authorizations or pre-approval on MRIs and CT scans and stuff like that. And oftentimes I'll call a place and they'll say, well, we can't give you the number to the pre-approval department. Well, once I get that number, that's gold. That's going in my phone. And then, man, I call them and I get to know them just like you get to know these insurance companies. And now you know what they need. And so I can say that. But, you know, the doctor by now is long gone. The appointment is over. The patient's been ordered an MRI and it needs pre-approval. And it's the same situation. It's okay. You got to put this in the chart. I need this in the chart, this and this and this, so that it can get pre-approved. I've even had insurance companies tell me, I'm sorry, it's been denied, and it's not up for approval again for another 3 months. In the meantime, the guy's walking around with a broken back and has severe pain, and we don't know what's wrong because we can't get the MRI. And
Mm-hmm.
even when I go to other doctors and specialists and say, you order the MRI, let's start this process again. The insurance company comes back and says, I'm sorry, Dr. X already ordered it. And we told you it's going to be 3 months before we'll even look at a process again of approval.
Yep.
So,
And we see that a lot with drugs as well. That's why I said earlier, I like to do the written appeal before I call and do a peer-to-peer review where I do the appeal on the phone. Because a lot of times with these insurances, if you call and do the initial appeal over the phone, when they close that out, if it's denied, then they close it out for 60, 120, 180 days. So you can't do anything else after that. So I like to have that first initial try. If it's approved, great. If it's not, then I have another step that I can take. But if I take that last step first, which seems like the most logical thing to do at the end of the day, that seems like, okay, if you can call and just get it approved same day, why wouldn't you do this? Because I know how these insurances work and I know that they're going to fight tooth and nail to not cover something. So it's easier to have the first appeal. They'll deny, if they deny that appeal, then they send something to us that has the information that we need on what's missing or what the reasoning why they won't approve it a little bit further past the initial denial letter that we received that has all this in it. Because the denial letters that they send tell you exactly why it's not approved. And then you can kind of go back to the doctor and say, okay, this is why. Can we add this information? If the doctor has the ability to add that information to the chart notes, or if not, then they can then call the insurance, or whoever does the prior authorizations can call the insurance and do it that way. Plus, for these offices that don't have a pharmacist that handles these things for them, that last effort, that peer-to-peer review, it is the doctor that has to call. The nurse doesn't call, the doctor does, and the doctor
right.
is busy. So it may be a couple days before they get to do get a chance to do it. So it's easier to do the written appeal first and see where we can get from there. And with that being said, though, sometimes it takes a little bit longer to do it this way. So it's just kind of dependent on how emergent the situation is to how it's handled, basically.
That's very interesting. I did not know that. So do the written appeal before you get slammed.
Unless it's an absolute emergency and it is something that like they need right now. In such case, like I would just go ahead and call the insurance and okay, this is why I
Yeah.
need this.
When I worked the emergency room, all I had to do was say I was, Suzanne calling from the emergency room, and I pretty much I had a
Yeah,
doctor on the phone in seconds.
yeah. They give you
Just,
someone right away and then it
yeah.
like you explain what's going on and most of the time they will approve it, especially if it's something that's kind of emergent. If it is an emergency, because at the end of the day, even the insurance companies, like the clinicians and the pharmacists, the doctors, all those people that work at the insurance company, they took an oath as well. They don't want to see a patient do horribly or die or get more sick because they're not able to approve something for you. So at the end of the day, they want, in a roundabout way, they want what's best for you, but they
Sure.
also have to do what the people in charge are telling them to do. So they can't always give you what they probably know is best for you.
Sadly. Well, we'll close this out. Thank you so much. You've been a wealth of information, Ashley. I can't tell you. I mean, working both retail and behind the scenes like you do now, your expertise is phenomenal. I mean, everybody, I'm sure, who's watching this and going to be watching it probably thinks, can I have her in my back pocket, please? But
Hopefully,
I thank you so much for helping us with this and,
no
getting the
problem
word
at
out.
all. Yeah, anytime you need something, you know where to find me.
I do. I do. Thank you. And yes, I probably, calling you too much too often, saying, what about this and what about that? But just let me know if I just, call you too often.
Of course. You know there's no such thing.
Thank you. You're so sweet. And we'll talk to you later. Take
All
care.
right.
All right.
Bye-bye.
Bye-bye.